The human cornea is the clear dome on the front of the eye. It serves to focus light on the retina, and for good vision, the cornea needs to be the proper shape, it needs to be clear, and it needs to be compact, in other words, not swollen. The cornea is the windshield of the eye and has a central thickness of approximately 1 millimeter. There are 3 layers of the cornea: the epithelium, the stroma, and the endothelium. If you think of the cornea as a structure like the roof of the Astrodome, the outer layer of the cornea, or the shingles, is the epithelium. The middle layer, or the structural beams, is the stroma, and the inner layer, or the ceiling tiles, is the endothelium. As seen in this picture on the right, the endothelial cells should be arranged like stones on a cobblestone street. When they start to degenerate, either by hereditary failure called Fuchs, or after trauma from surgery or time, the cells start to break down and lose their ability to pump water out of the middle layers of the cornea. Abnormal function of the corneal endothelium leads to corneal stromal edema, as well as microcystic edema, or swelling on the surface of the eye, such as if the shingles of the epithelium are coming off. This results in blurred vision and, in some cases, severe pain. Symptoms from corneal decompensation can include pain or a scratchiness like something's in the eye, blurred vision, in some cases that can be worse in the morning and improves throughout the day, or blurred vision that is persistent throughout the day and night, associated with significant glare and difficulty with night driving. Some cases of corneal decompensation can resolve with time, along with drops such as steroids or hypertonic saline drops such as Muro 128. Other times, a surgical correction is required. Traditionally, the surgical treatment for corneal decompensation was penetrating keratoplasty, or PKP. However, now, endothelial keratoplasties such as DSAEK and DMEK have become much more popular with much quicker surgical results. In endothelial keratoplasties such as DSAEK and DMEK, endothelial cells are used from a donor cornea. Various techniques for installation of these cells are used, but ultimately we are replacing the ceiling tiles of the recipient cornea with new cells. Once the new corneal cells are in place and the corneal edema has had a chance to recover, the vision can again become very sharp. Corneal transplants can last for years. However, there's always a lifetime risk of corneal rejection or failure. If you experience redness, pain, sensitivity to light, or decreased vision, make sure you contact us immediately so that we can increase the drops to reverse the rejection. The risk of rejection in DSAEK and DMEK is much less than that of penetrating keratoplasty. This plus the speedy recovery makes this a very successful procedure. Please give my office a call to set up an appointment or to discuss any questions that you may have regarding endothelial keratoplasty, DSAEK, Fuchs dystrophy, corneal decompensation, and other corneal surgeries.